For our presentation today, we will be presenting about exercises for obesity. Before we head on into our topic, I would like to introduce our group members. First, we have Sarah Khairin binti Muhammad Haliza. We have Sofia binti Yahya, Nurin Aimi Yasmin binti Auri Hazat, Nur Alia Balkis binti Ruslan, and lastly, we have Ain Nazira binti Norman.
What is obesity? Obesity is a medical condition characterized by an excessive accumulation of body fat that poses a risk to health. It is commonly defined as body mass index, which is BMI, a measurement that compares a person's weight to their height. A BMI of 30 or higher is typically classified as obese, while a BMI between 25 and 29.9 is considered as overweight. So, what are the causes of people getting obesity? The first one is poor diet. Consuming high-calorie foods, especially those rich in fats, sugars, and processed ingredients, is one of the main contributors to obesity. The second one is lack of physical activity. Sedentary behavior such as sitting for a long time of periods can lead to weight gain. Inactive lifestyle also make it harder for the body to burn enough calories, which leads to more calories being stored as fat instead of being used for energy.
Now I will explain about type of obesity. Obesity is typically defined as having a body mass index BMI of 30 or higher. Obesity is categorized into 3 types based on severity. So first one is obese class 1, mild obesity. It refers to individuals with a BMI of 30 to 34.9, which poses a moderate risk of health issues like high blood pressure and diabetes. Second is obese class 2, moderate obesity. This refers to a BMI of 35 to 39.9 and higher. In this class, it have risk of more serious health problems such as heart disease and joint pain, this requiring targeted treatment. Last one is obese class 3, severe obesity. This is the most critical stage of obesity, with a BMI of 40 or higher. This stage is associated with life-threatening conditions like stroke and organ failure. By understanding these classifications, it helps in managing health risks and determine appropriate treatment.
Next, we move to physiological effect of obesity. Here, we have 4 factors that lead to physiological effect of obesity. The first one is cardiovascular system. The effect from the system to obese is it can increase the risk of heart disease. For explanation, the hearts need to work harder than normal to pump blood through the body, so this situation can lead to high blood pressure or hypertension. The second one is respiratory system. The effect from the system is it can increase the risk of sleep apnea. For explanation, fat that store around the neck can make the airway too small, which can make breathing difficult at night, and breathing may actually stop for a short period of time. Number 3 is musculoskeletal system. The effect from the system to obese is it can give joint stress because of extra weight can also put too much pressure on the joints, leading to pain and stiffness. The last one is mental health. People who suffer from obesity lead to increased risk of depression and anxiety. This effect may make controlling weight even more difficult for obese.
Next, I will explain about psychological effect of obesity and explain how it impacts mental health and overall well-being. First, low self-esteem and negative body image. People with obesity often struggle with confidence and have a negative perception of their physical appearance, leading to low self-esteem and body dissatisfaction. Second, depression. Obesity is linked to an increased risk of depression. Many individuals experience persistent feelings of sadness, hopelessness, or a lack of motivation as a psychological response to their condition. Third, reduced quality of life. Obesity can significantly lower a person's quality of life. It affects their sense of well-being and limits their ability to enjoy daily activities. And last one, social anxiety and isolation. Many people with obesity experience social anxiety and isolate themselves to avoid judgment or difficult situations. This isolation often stems from fear of social interaction or a way to cope with anxiety. By understanding this effect emphasizes the importance of addressing both the physical and psychological aspect of obesity in treatment.
So, this is our client profile, which is Faiz Aminuddin bin J. Samsudin. He is 22 years old and of course he is a male student. His height is 167 cm and his weight is 137 kg. So, his physical condition that Faiz have is obesity and his goal is to lose weight. So, the first exercise that we program for Faiz is first we need to do a warm-up session, which is we choose to do a brisk walk on treadmill for 5 minutes. And then the second one is squat, which is 12 to 15 reps for 3 sets. The third one is bicep curl and shoulder press, which is 12 to 15 reps and 3 sets. The last exercise is crunches, which is 10 to 12 reps and 3 sets. For the last one, we do a cooling down for 5 minutes.
Before starting our exercise program video, this is an important step for every personal trainer who is doing a personal training for its client. So in this step, every personal trainer needs to prepare a concept form called PARQ. So in this PARQ concept form, it includes the medical history and how old they are and many more. So this is to help in case of medical issues or anything that happens during the training.
Hello and welcome to our exercise program tailored for individuals managing obesity. Our goal is to design a safe, effective, and enjoyable season that promote health and well-being. Today we have Faiz, who is excited to embark on this journey with us. Before we start, Faiz has completed the PARQ form and signed the informed consent for safety purposes.
We will begin with a 5-minute brisk walk to warm up, followed by some dynamic stretches to prepare the body for the exercise.
So our first exercise is bodyweight squat. This helps strengthen the lower body and improve balance. So for this exercise, we need to do 3 sets and of 12 to 15 reps with breaks.
Okay, next we'll perform a combination of bicep curl and shoulder presses to target the upper body. This exercise completing 3 sets of 12 to 15 reps with breaks.
So our final exercise will be crunches. So crunches will be focusing on our core and stability. So for this exercise, we will be doing it for 3 sets for 12 to 15 reps.
Okay, let's finish with a cool down session to relax the body and prevent the soreness.
So Faiz, how did you find today's session?
Everything was fun. Every exercise in this training program is suitable for me and enjoy for me.
Alright. So what is your next target?
So for my next target, I will try to continue and consistent in training program to achieve my goal, which is to lose weight.
Alright. So I hope you can commit to continue the assessment.
Alright, thank you.
Thank you for joining today's session with us. Remember, consistency is the key to achieving your goal. Stay active and take care.
For the suggestions, first, boost your motivation. Motivation drives consistency in achieving your health and fitness goal. Start by setting small, realistic target like losing 1 to 2 kg a month or walking for 30 minutes without tiring. Celebrate small wins such as completing a workout or eating healthy for a week. Surround yourself with supportive people and remind yourself why you began, whether it's to feel healthier, have more energy, or gain confidence. Tips to stay motivated. First, set realistic goals. Begin with manageable goals such as walking for 10 minutes daily, then gradually increase the duration. Second, track progress. Use a journal or fitness app to log your activities. Seeing your progress keeps you inspired and show how far you've come. Second suggestion is start with low intensity workouts. When beginning an exercise routine, start slow to avoid overexertion. Choose simple activities like walking, stretching, or light cycling. These are gentle on your joints and muscle, especially if you are carrying extra weight. Gradually increase intensity as your fitness improves. For example, start with 10 to 15 minutes of walking and build up to 30 minutes over a few weeks. Why low intensity works? First, prevent injuries. Starting slow helps your body adjust without strain. Second, builds consistency. Low intensity exercise are less intimidating and more enjoyable, making it easier to stick with them. For the last suggestion is manage your daily diet. Your diet plays a big role in weight management. Focus on balanced meal that includes vegetable, lean proteins, whole grains and healthy fats. Limit sugary drinks, processed snack and large portion. Eating smaller, more frequent meals helps maintain energy and prevent overeating. Use a food diary or app to track your meals and spot areas for improvement. Even small changes like swapping soda to water or adding more veggies to your plate can make a big difference. Simple diet tips. First, eat balanced meal that include lean protein, whole grains, healthy fat and plenty of fruits and vegetable in your meals. Second, avoid processed food. This food can contribute to weight gain and do not provide essential nutrients. Prepare meals in advance to avoid last-minute unhealthy choice.
In conclusion, regular exercise is a vital tool for managing obesity as it enhances both physical and mental health. A well-rounded exercise program that includes cardiovascular, strength, and flexibility training helps boost metabolism and support sustainable weight loss. It also reduces the risk of chronic diseases such as diabetes and heart disease while improving mobility, balance, and overall fitness levels. Beyond weight loss, exercise is about building a foundation for long-term health. It fosters strength, confidence, and an improved quality of life. Consistency is the key to success, starting with small, achievable goals and progressing gradually, ensuring lasting results by committing to regular physical activities. Individuals can not only transform their bodies but also enhance their overall well being.